Anti-CD74 antibodies are an emerging biomarker in rheumatology, especially in relation to spondyloarthritis (SpA). Here's a concise overview. 1. What is CD74? CD74, also known as the invariant chain, is a type 2 transmembrane protein associated with MHC class II molecules. It plays roles in antigen presentation, immune cell survival and activation. It also functions as a receptor for macrophage migration inhibitory factor, MIF, a cytokine involved in inflammation. 2. Anti-CD74 antibodies in spondyloarthritis, high prevalence in early axial SpA patients, especially in HLA-B27 plus individuals, may appear early in disease, sometimes before imaging changes. More common in non-radiographic SpA than in long-standing ankylosing spondylitis. Potential use as a diagnostic biomarker, especially where MRI is inconclusive or unavailable. 3. Diagnostic value. Some studies report anti-CD74 sensitivity around 50 to 70% and specificity up to 90% for early axial SpA. Not yet widely standardized or used in clinical practice due to limited availability of commercial assays, need for further validation in large-scale cohorts. 4. Other associations. Occasionally seen in other autoimmune conditions, but more specifically studied in SpA. Levels may correlate with disease activity, though this is still under investigation. Summary. Anti-CD74 is a promising biomarker for early axial spondyloarthritis, potentially useful in patients with inflammatory back pain and equivocal MRI findings. However, its routine clinical use is still investigational, pending further validation. Would you like references or visual slides summarizing this for teaching? Several studies have investigated the diagnostic utility of anti-CD74 antibodies in axial spondyloarthritis, AXSPA, yielding varying results. Here's a summary of key findings. Anti-CD74 IgA as a diagnostic marker. Study by Berlek et 2022. In a cohort of 281 AXSPA patients, anti-CD74 IgA levels were significantly higher compared to fibromyalgia FM and rheumatoid arthritis RA patients. Using a cutoff of 15 U per milliliter, the test demonstrated a sensitivity of 60% and specificity of 87% for distinguishing AXSPA from FM. However, anti-CD74 IgA levels did not correlate with microscopic gut inflammation or other disease-specific features. Inter-SpA study. This multicenter study assessed anti-CD74 antibodies in non-radiographic AXSPA. The sensitivity of IgA anti-CD74 was 47%, with a specificity of 95.3%. When combined with HLA-B27 testing, the post-test probability for AXSPA increased significantly, suggesting that anti-CD74 IgA may enhance diagnostic accuracy when used alongside other markers. 2. Longitudinal observations in radiographic axis, Swedish backbone cohort, 2021. Among 155 patients with radiographic AXSPA, 23.2% tested positive for IgA anti-CD74. Higher antibody levels were independently associated with the presence of syndesmophytes, indicating a potential link between anti-CD74 IgA and structural spinal changes. However, antibody levels fluctuated over time without a consistent pattern. 3. Limited diagnostic value in early AXSPA. Space cohort study, 2018. In patients under 45 years with early back pain, anti-CD74 IgA antibodies were present in 54.7% of AXSPA patients and 37.0% of those with chronic back pain, CBP. The positive predictive value was 58.8%, and the negative predictive value was 59.1%, indicating limited utility of anti-CD74 IgA in early disease stages. 4. Potential in low HLA-B27 prevalence populations. Lebanese study, 2019. In a population with low HLA-B27 prevalence, IgG4 anti-CD74 antibodies demonstrated a sensitivity of 92% and specificity of 79% for AXSPA. Notably, 88% of HLA-B27 negative AXSPA patients were positive for IgG4 anti-CD74, suggesting its potential as a diagnostic marker in such populations. Anti-CD74 antibodies, particularly IgA and IgG4 subclasses, show potential as diagnostic markers for AXSPA, especially in specific populations or when combined with other tests like HLA-B27. However, their standalone diagnostic value varies across studies, and further research is needed to standardize their use in clinical practice. If you would like more detailed information on any of these studies or assistance in interpreting these findings in a clinical context, feel free to ask. The relationship between anti-CD74 antibody levels and disease activity in axial spondyloarthritis (AI) is still under investigation, and the findings so far have been mixed. Here's a breakdown. 1. Correlation with disease activity. Most studies have not found a strong or consistent correlation between anti-CD74 titers and disease activity indices, such as BATH ankylosing spondylitis disease activity index, CRP or MRI inflammation scores. Examples, Berlekin at 2022, found no correlation between anti-CD74 IgA levels and BASDI, CRP, or gut inflammation. SPACE cohort 2018, anti-CD4 IgA was not associated with higher disease activity at baseline. Swedish backbone cohort, although IgA anti-CD74 was associated with structural damage, syndesmophytes, there was linked to active inflammation markers. 2. Does the titer matter? There is no established clinical threshold at which the titer of anti-CD74 becomes prognostically significant. Most commercial or research assays define a positive versus negative result using cutoffs, e.g. 15 U-milliliters, but graduated titers are not used to guide treatment or predict severity. Unlike anti-CCP and RA, higher titers of anti-CD74 have not been clearly linked to more severe or progressive Axial SpA. 3. Potential roles beyond disease activity. Anti-CD74 may reflect an early immune dysregulation rather than ongoing inflammation. There's some interest in whether these antibodies might help identify subtypes or predict radiographic progression, but this is not yet validated. Summary. Anti-CD74 antibodies are more useful as diagnostic markers than as indicators of disease activity. Titers do not currently influence prognosis or treatment decisions. No strong evidence supports a role in monitoring disease activity or response to therapy. Would you like a summarized slide or a figure comparing anti-CD74 to HLA-B27 and CRP in Axial SpA diagnosis and monitoring? Yes, there is a notable study that addresses the diagnostic value of anti-CD74 antibodies in populations with low HLA-B27 prevalence, such as those in the Middle East. Key study, anti-CD74 in a Lebanese population. A 2019 study conducted in Lebanon, a country with one of the lowest reported HLA-B27 prevalences, approximately 4% in the general population and 33% among Axial SpA patients, investigated the utility of anti-CD74 antibodies as diagnostic markers for axial spondyloarthritis, Axial SpA. Findings. IgG4 anti-CD74 antibodies demonstrate a sensitivity of 92% and specificity of 79% for Axial SpA diagnosis. Notably, 88% of HLA-B27 negative Axial SpA patients tested positive for IgG4 anti-CD74 antibodies. The combination of HLA-B27 and IgG4 anti-CD74 testing increased diagnostic specificity to 98%, with a positive likelihood ratio LR plus of 16.5. IgG4 anti-CD74 levels also showed a correlation with the BATH ankylosing spondylitis disease activity index, BASDI, suggesting a potential link to disease activity. Implications for populations with low HLA-B27 prevalence. In regions like the Middle East and parts of Africa, where HLA-B27 is less prevalent and thus less reliable as a diagnostic marker for Axial SpA, anti-CD74 antibodies, particularly the IgG4 subclass, may serve as valuable supplementary biomarkers. Their high sensitivity and specificity, especially among HLA-B27 negative patients, highlight their potential utility in improving early and accurate diagnosis in these populations. Further research in diverse populations with low HLA-B27 prevalence would be beneficial to validate these findings and potentially incorporate anti-CD74 antibody testing into standard diagnostic protocols for Axial SpA in such regions. Yes, several emerging biomarkers beyond HLA-B27 and anti-CD74 are under investigation for their potential roles in the diagnosis, disease activity assessment, and prognosis of axial spondyloarthritis, SpA. Here's an overview of some notable candidates. Autoantibodies and immune markers. Anti-PPM1A antibodies. These target protein phosphatase magnesium-dependent 1A, PPM1A, involved in bone morphogenetic protein and WNT signaling pathways. Studies have identified these antibodies in Axial SpA patients, with levels correlating to disease activity and decreasing with anti-TNF therapy. However, their diagnostic performance is currently insufficient for routine clinical use. Anti-sclerostin IgG in patients with inflammatory bowel disease, IBD-associated SpA, elevated levels of anti-sclerostin IgG and decreased sclerostin levels have been observed, suggesting their potential as biomarkers for axial involvement in IBD-associated SpA. MicroRNAs, circulating miRNAs. Specific miRNAs, such as MyR146A5P, MyR125A5P, and MyR223P, have been found to be differentially expressed in Axial SpA patients. A composite signature of 6 miRNAs demonstrated high diagnostic accuracy with an area under the curve, AUC, of 0.96, indicating their potential as non-invasive diagnostic biomarkers. Bone and cartilage turnover markers. Phe2Na. This glycoprotein is associated with bone metabolism. Elevated serum levels have been linked to sacroiliac joint damage in early Axial SpA, suggesting its role as a biomarker for structural progression. Matrix metalloproteinase 3, MMP3. MMP3 levels have been associated with disease activity and treatment response in SpA, although findings across studies are inconsistent. This marker reflects type 1 collagen degradation. It has been shown to differentiate Axial SpA patients from those with other back conditions and responds to anti-TNF therapy, indicating its potential as both a diagnostic and pharmacodynamic biomarker. Inflammatory and metabolic markers. Macrophage migration inhibitory factor, MIF. Elevated MIF levels have been observed in Axial SpA patients, particularly those with disease progression and existing syndesmophytes, suggesting its role in disease pathogenesis. Neutrophil to lymphocyte ratio, NLR, and platelet to lymphocyte ratio, PLR. These hematological ratios have shown potential in predicting radiographic sacroiliitis and monitoring treatment response, offering accessible markers for clinical practice. Genomic and proteomic approaches. Gut microbiome profiling. Quantitative metagenomics has identified distinct microbial signatures in Axial SpA patients, with diagnostic algorithms achieving high discriminatory capacity, AUC of 90 to 95%. These findings highlight the potential of gut microbiome analysis in Axial SpA diagnosis. Proteomic analysis. Studies have identified upregulated proteins in the synovial fluid of Axial SpA patients, including MMP1, MMP3, and complement components, which may serve as novel biomarkers for early detection. Advanced imaging biomarkers. Volume of hyperintense inflammation, VA. Utilizing deep learning algorithms on STIR MRI sequences, VHI quantifies inflammation load in Axial SpA, offering a more objective and reproducible imaging biomarker compared to traditional qualitative assessments. These emerging biomarkers hold promise for enhancing the diagnosis and management of Axial SpA, particularly in populations where traditional markers like HLA-B27 have limited specificity. However, further validation in diverse cohorts and integration into clinical practice are necessary steps forward.